Hi everyone, so I'm making this video as a short intro, and I wanted to talk a little bit about HPV and what a colposcopy is, what a leep is, what cervical dysplasia is, and forgive me if I'm pronouncing any of this wrong, but I kind of wanted to talk about it a little bit. A little background on me. I went to the GYN for a regular checkup, as most women do. I have a daughter who's 3.5, and my husband and I are looking to start trying to conceive for our second. I went to the doctor, like I said, as normal women do, and I had a regular pap and all that stuff. So, long story short, after my pap, it's supposed to be routine. Typically, if you don't hear back from them, then you're all good and you have no issues. I think a week and a half later, the receptionist from the clinic that I go to called me to let me know that my pap smear came back abnormal. So I was like, okay, and she wanted me to come back. So I was like, okay, no big deal, whatever, I'll go back and see what she says. I had an abnormal pap years ago before my daughter, and it was the way that they explained it to me was that it was abnormal, but it wasn't abnormal enough for them to do anything about it. So it just it just went away, and then after that I had normal paps, and then I had my daughter. So like I said, I went and I thought nothing of it. So when I get there, the doctor was like, okay, so you had an abnormal pap smear, you tested positive for HPV, and we want to do something called a colposcopy. Basically, this is something that they do whenever you have an abnormal pap, and typically more when you have HPV positive. So I guess the pap smear also allows them to tells you that you have abnormal cells present. So what they do the colposcopy for is basically to see if the abnormal cells that are present are cancerous, or if it's precancerous, etc. So, okay, so fine, I make the appointment. I was freaking out because, of course, as soon as I got out of there, I started Googling everything under the sun, and nothing that I found on the internet was very pleasant to look at. Not only that, my doctor, she's a very good doctor, but she is about 80 years old, I think. She's just really old, and they're like the old school mentality doctors that are just very cold, and they don't give you more information than what you really need. So if you're not prepared with a list of questions for her, she's not going to willingly give up the information. So long story short, I make the appointment, I go home, I'm like Googling all this stuff, I'm worried, I'm crying. I tell my husband, and he's like, oh, stop freaking out. He literally had to pry the phone out of my hands so that I would stop Googling all this stuff. So whatever. I go, I have the colposcopy. The colposcopy itself, for me, which is just the biopsy, was awful. Basically, they lay you down on the bed, on the little bed thingy. They put your legs in the stirrups, kind of like if you were having a regular pap smear. And what they do is they have like this thing, and it looks like a microscope. So she sits there with this light, and she looks through like these binocular things, and they have little knobs on them so that you can kind of zoom in and zoom out. And basically what they do is they take a cotton swab and they put like some vinegar solution on it. And what happens is, let's say this is your cervix, they take the solution and they rub it all around the cervix. And what they do is they check to see if the area that's affected turns white. So think of it as, when you were little and you had a cut, and you take, what is that, peroxide, and you spill it over. It doesn't hurt, but it does bubble in the area that is cut. So, whatever. She did all that. It took a really long time. I swear it has a lot to do with the fact that she's old and she probably can't see too good. But yeah, it took a really long time. It was extremely uncomfortable. It was very uncomfortable, more than painful. You do feel cramping when she is scraping off or cutting out the little sample tissue pieces. And it did take a really long time. I mean, some people say that it is extremely fast. Some people say that it takes a while. Some people feel uncomfortable. Some people say they don't feel anything at all. It really depends on the person. And I like to think that I have a high pain tolerance, but it was so uncomfortable and I was miserable the whole time. So what they do is they take a sample from the affected area. And typically also if you have dysplasia anywhere near the canal, which is the center portion of your cervix, they do take a little piece of kind of near, not inside, but near the opening. So we did that. She told me that she would have results for me in 2 weeks and that to make an appointment, and I did. I did have bleeding, I did have cramping, and it did feel kind of weird when I peed. They also, I guess when they cut the pieces out, since your cervix is very vascular, it does tend to bleed a lot, even for a little cut. So what they do is they put a liquid bandage on it, and it's like, I guess it's brown because you do like pass it. You do get a lot of discharge. Sorry if it's TMI, but it does discharge, and you see it, and it does look like little grains towards the end, I guess when it's healing and it's falling off. So I had a few days of that, of the brown in the beginning, and then I had almost a whole week of bleeding. They do tell you that if the bleeding is more than your regular period, you should call them immediately. I did have blood. I was actually on a business trip at the time, out of the state, so I did call because I was a little concerned about the amount of blood that I was passing. However, I was popping Advils like no other because I had a horrible migraine that day, and so I figured, you know, doesn't ibuprofen kind of thin your blood, so I figured maybe I was bleeding more because of that. But it went away and I was fine. So right after that, she calls me again and she lets me know that I will be needing something called a leep surgery. So when I go into her office once again, at this point I am bawling, like in her office, full-blown tears, fire, the whole nine. The whole time I'm sitting there, this chick is just, well, I shouldn't say chick because she is older, but this lady's just sitting there looking at me like she didn't even offer me a tissue or anything. Talk about not comforting whatsoever. So I'm sitting there because this time, since I knew that she isn't very forthcoming with information, I did sit there while I was in the waiting room and I did write a bunch of questions down and what my concerns were. I did know that if they did find something, that the next step would be a leep surgery because that's what I had read. I did read the risks associated with a leep, which could be preterm labor, it could cause miscarriages, and all sorts of things. And to me, that wasn't ideal since I was going to try to conceive. And that was the whole point, well, not the whole point, but part of the reason why I actually went into the GYN to begin with. Typically, if you are younger, I'm 27, so typically if you are younger, because younger women do get this, they do try and put off the leep if you don't have any children and you're younger, because they try to, I guess, limit the risks involved. So I told her what my concerns were. She said that she no longer performed the leep, I guess because she was just not doing it anymore because she's too old or whatever. So she did recommend me to her partner that is in the same office, so she told me to make an appointment for that. So, okay, I leave and make the appointment. Once again, I'm walking to the car, bawling. I call my mom, and I'm like, oh my God, Mom, I don't know what to do, blah, blah, blah. My aunt is a GYN. I am fortunate to have a doctor aunt in the family. I did call her, and she basically said to me, you know, this whole procedure is totally not worth your tears. She said it's a lot more common than we think that it is, and people just don't talk about it. So another reason why I wanted to make this video was to inform that if you do have to have a leep performed, it is not the end of the world, although it does sound very scary because it is a surgery. It's not the end of the world, and it is a lot more common than you would expect. After this diagnosis for me, I have mentioned it to my girlfriends, and a lot of them have said, oh, that happened to me, or I know somebody that it happened to. So it is a lot more common, and just because we don't hear about it doesn't necessarily mean that people haven't gone through it. It's kind of like one of those things where You know how you meet somebody new, or you hear about a brand name or whatever it is. Let's say something that you've never heard of before, and then you hear about it, and then you start seeing it everywhere. So it's kind of like that. So I explained to my mom, kind of explained it to me, and everything was still a little nerve-wracking, because at the end of the day, although she's my aunt, she's a doctor, and she sees everything from the most logical point of view versus the freaking out point of view, which is what I was doing regardless. My husband was basically like, just calm down, let's wait and see what they say, yada yada yada. So fast forwarding, I went to my appointment to meet the doctor that was going to be performing the leap, and immediately when I saw him, I felt so much better, because of the simple fact that his first words, the first words that came out of his mouth when he saw me was, "Do you understand what cervical dysplasia is? What is going on with you? Do you understand everything?" And automatically I said no, because once again, I was nervous again, and I wanted to kind of hear the whole definition from somebody's mouth versus just what I find on Google and Wikipedia and YouTube. So he sat there and he explained everything to me, and he gave me the best analogy in the world. So he told me, you are aware that you are HPV positive. You are aware that you had a colposcopy, and it came back saying that you had, sorry, and I'm sorry if I didn't mention this before, but I did have CIN2, which means it's in the middle. There's 3 different forms of it: CIN1, CIN2, and CIN3. So I was kind of in the middle. CIN1 being very mild, CIN2 being medium, and CIN3 being severe. So I did have medium lesions on my cervix. So he did explain to me that whenever it's CIN1 and it's mild, they typically just don't do any procedures and they just watch it. When it's CIN2, they take that a little more serious, and they like to do the leap, because the leap doesn't only treat it, but it does give them enough time to have it biopsied to make sure that it doesn't go any deeper into the cervical canal. So basically, this is the way he explained it to me. So you think of an apple. If you have an apple, and you know how sometimes apples tend to have bruises on them because they fell or whatever. So if you have an apple and it has a bruise and you cut the bruise, sometimes when you cut the bruise off, the bruise is gone, the apple is still good, and you can eat it. Sometimes when you cut the bruise off, the bruise goes in deeper. It penetrates further into the apple, and that's what they do the leap for. So it's to treat it and to biopsy it to make sure that the margins behind the infected area are completely clear. And basically that's what the leap does. He did explain to me that 70% of what they cut out or cut off from your cervix grows back. And he also did say to me that based on the report that he got from the pathologist, that the sample, the biopsy that she took from the opening or the near opening of my cervix didn't show any dysplasia. So he was confident that he wasn't going to have to remove much, and that I was going to be able to continue trying to conceive 2 weeks after my whole leap procedure, which is good news because the previous lady told me something like 3 months. So I felt extremely comfortable. So the moral of that story is to make sure that you feel comfortable with your doctor. Make sure that your doctor is meeting your expectations and answering all of your questions. If you are like me or like anybody else who tends to forget things when they get nervous or when they are caught up in the moment, write things down. The one thing he said to me that really put me at ease was, ask me as many questions as you want, he said. Even if we're rolling you into the ER to have this surgery, if you have a question, I will answer it. And that really put me at ease because it was like, oh wow, you know, he really cares about me and my comfortability, if that's even a word. So that made me feel good. So he scheduled it right away. We wasted no time. 2 weeks later, I was the first appointment, first surgery. My husband went with me because they do require you to have somebody to drive you back home. And they put me to sleep completely. I have seen some videos where some women, when they get their leap done, they are numb from the waist down, but they're still awake. They actually numbed me, like put me to sleep completely. So I didn't feel a thing. It was literally lights out, goodbye, woke up, and it was done. To be completely honest with you, the colposcopy was more of a pain in the butt, the biopsy, than this whole leap thing was. It's been a week and 8 or 9 days since I had my leap surgery, and I have yet to bleed. I didn't have as much of the brown discharge as I did when I had my colposcopy. I am having some discharge, sorry TMI, but it wasn't nearly as bad as it was for when I had the colposcopy. I am supposed to go back on Tuesday to see what my results are and to hear the thumbs up that the margins behind the affected area were clean, and then after that he's going to give me the green light to try and conceive, which I'm trying to focus on more because that's the more exciting part about it. I feel like if I continue to freak out about what my results are going to be, I'm just going to be that freaked out. I'm going to try not to think about it anymore, and hopefully I do hear good news. I will totally keep you guys updated. I want to try and record this whole journey of, my colposcopy, my leap, my result, and then my whole trying to conceive, to see if it happens when I want it to, because you know how sometimes when you really want something, it just doesn't work out the way you want it to. So I'm hoping that that's not going to be my case, and that everything goes through smoothly. If you guys have any questions, please feel free to comment down below, and I will try and answer them as best as I can, and that's pretty much it. Thank you so much for watching, and I hope to give you guys some good news in the next coming week.